Hi there. Today we're talking about heartburn. I'm Dr. Andrea Purcell, and you're watching another edition of Straight from the Doctor's Desk. So gastric reflux today, why it's a silent killer, how the medications band-aid the symptoms, and what you can do to reverse it. Hang out with me because this is where natural medicine is used as the first resort to help you achieve the health and the life that you love. So I've been practicing naturopathic medicine for 20 years. I like to say that none of us have months or years to waste with poor health when there is something that can be done today to reverse and prevent it. So my goal is to educate you and empower you about natural medicine so that you can learn about it as a solid consideration for you and your loved ones. And as Mary Oliver says, what are you going to do with this one great precious life that we have? So today we're focusing on heartburn. You know, the digestive system is the most important system in our body. It takes the food we eat, it extracts the vitamins and minerals from it, and then those are transferred out to our other organ systems to feed our bones, our brain, our hair, our heart, and so on. So when the digestive system is not working properly, every other part of our body suffers. And this is such a big, tremendous topic that we're just focusing on the upper digestive tract today, mainly gastric reflux and heartburn. Is there a natural way to soothe the burn? Yes, there is. Then we have some scary statistics. We've got 100 million Americans dealing with heartburn every single year. I mean, that's a third of us. I mean, heartburn, indigestion, gastroesophageal reflux disease. These are all different terms to describe the exact same thing. And heartburn really is a slang term. Many people experience this condition without any burning at all. Symptoms arise when digestive juices from the stomach backwash into the esophageal tissue. So esophageal tissue is not made to handle stomach acid. It's not made of the same durable tissue as our stomachs. And it is subject to a lot of inflammation and damage by stomach acid. So if we let heartburn go on and be untreated, it can progress to esophageal cancer. And the prognosis with that is not good. So most people ignore heartburn as an important clue from our body. And they just say, oh, I'm going to take some Tums, or I'm just going to rely on this medication my doctor gave me to suppress the symptoms. But heartburn is simply a symptom that the digestive system is out of balance. And when we ignore it, like many things that we tend to ignore, it can really blow up in our face. So it's similar to driving a car with the check engine light on and ignoring it. And we're just using a Band-Aid approach, so maybe we're going to cut the wire on the check engine light and take some Tums, but it is going to lead to bigger problems down the road because it just buys us some time. And what are we looking at? We're looking at more costly repairs in our car and more costly repairs and invasive procedures to our body. So we just have to be honest when something's broken and put our attention on and fix it. And honestly, taking Tums, which is a quick fix, is tempting. When you find yourself tossing and turning at night with indigestion, heartburn, gas, that makes sense to reach for it as a short-term fix. But the real solution here to a healthy gut is to give your stomach what it needs. And in this case, it's more stomach acid, not less of the very acid you're struggling against. And we'll talk about that. Acid blocking medications are a $13 billion a year industry in the United States. These medications are indicated for the treatment of gastric reflux, Barrett's esophagitis, peptic ulcer disease, H. pylori, the bacteria that causes stomach ulcers. These medications can also just be prescribed if you have a chronic cough, hoarseness, sour taste in your mouth, asthma, chest pain associated with GERD. Common names of these medications, you've heard them: Prilosec, Prevacid, Acifex, Protonix, Nexium. They act by lowering digestive acid in the stomach and specifically hydrochloric acid production and pepsin. Again, short term, It might be an okay idea to lower stomach acid if you're really uncomfortable and you don't know what to do in the moment, but for the long term, they don't make sense. And that's because stomach acid has a number of very important jobs in the body. We don't want to suppress it. And the chronic use of acid suppressing drugs does not help your overall health, as they've been linked to a wide range of health issues, including lowered immune function, reduced bone mineral absorption, bone fractures, difficulty digesting our food properly. They affect kidney function, and they cause bacterial, viral, and yeast imbalances in the intestinal tract. So stomach acid is the body's natural way to keep the growth of bacteria in check. The official name of stomach acid is hydrochloric acid. The production of stomach acid requires a lot of energy from your body in order to produce the amount necessary to maintain the acidity, the pH balance in your stomach. As we age and as we live on planet Earth, our stomach acid levels will diminish. And it's up to us to help re-bolster them and invigorate them and get them back up to when we were 25, right? So if you're 55, stomach acid goes down. We want to get it back up to the level it was when we were 25. And there are some important jobs of stomach acid. So let's talk about job number 1, protecting against foreign invaders. As the acid level is decreased in the stomach, it increases the risk of infection and bacterial overgrowth. And that's because stomach acid is our number 1 defense of the body against bacteria that can come in from drinking water or any food that we ingest. A bacteria on a piece of lettuce, it will block it and kill it. One study showed that 35% of patients who take Prilosec, so acid blocking medication, had bacterial overgrowth inside their digestive system, compared with the control group who only had 10% who were not on an acid blocker. Job number 2 of stomach acid, digesting our food. Our stomach acid allows for the proper breakdown and absorption of nutrients. When we are not getting this proper breakdown, it puts more of a strain on the other organs in the digestive tract to help break the food down. And that's not fair to them. We all got to share the load here, right? Job number 3 is absorption of vitamins and minerals. Essential food particles are broken down. Why? Well, to extract the vitamins and minerals that we need to feed the rest of our body. And this is the issue with increased fracture risk, where we're not able to absorb the vitamins and minerals from foods when we're taking an acid blocker. Acid blockers taken for over a year have been shown to increase fracture risk by 44% in women over 50, especially in where? The hip, the spine, the wrist, the forearm, all those places that women get breaks. Other long-term deficiencies of vitamin B12, zinc, iron, magnesium, and calcium. So here's the problem. Acid blocking medications are difficult to get off of. After we have suppressed stomach acid for a long time, it's hard to get off the medications because we often experience something called rebound acid hypersecretion, where we take the medications away, the body starts producing stomach acid again, and then people feel like, oh, my heartburn is coming back. And it can occur up to 12 weeks after discontinuing one of these. So we have to put some other digestive supports in place to help someone successfully wean off acid blocking medications and support digestive function so the condition is still not there. And this is where a natural approach comes in, because acid reflux is not caused by too much stomach acid, it's caused by too little. And then the acid that is there flows inappropriately out of the stomach into the esophagus, causing pain. So GERD is a condition where acid inappropriately backwashes out of our stomach into our esophagus. And GERD is really an area where natural medicine shines, because there are many ways to heal gastritis, GERD, peptic ulcers, esophagitis without any negative side effects. So here's what's actually happening in your body. After food passes through your esophagus into your stomach, stomach acid is released, which triggers a muscular valve called the lower esophageal sphincter to close. The lower esophageal sphincter prevents food or acid from moving back up into the esophagus. If there's too little stomach acid, it will not trigger the lower esophageal sphincter. Therefore, it stays open. So gastroesophageal reflux occurs when the lower esophageal sphincter is open and untriggered, which allows acid from your stomach to flow backwards into your esophagus. Stomach acid belongs in your stomach, no doubt. Esophageal cells were not designed to handle stomach acid. HCl backwashing into the esophagus can be very painful and damaging to that fragile tissue. So what are we going to do? This is where the natural treatments come in. So simply put, long-term therapy on acid-blocking medications is not an option. These medications should only be used short-term, while other more natural things are being considered behind the scenes to treat the underlying dysfunction. Often, many people can get relief simply by modifying their diet and their lifestyle. It is not due to an overproduction of acid, but it's due actually, in fact, to the lack of stomach acid that prevents the constriction of the lower esophageal sphincter. We want to reduce high caloric meals. We want to avoid eating after 7 p.m. Foods that come in a bag, a box, or a can are processed. They lack enzymes. They require more energy for our system to break them down. We want to avoid aspirin, anti-inflammatory medications. These are all damaging to the stomach lining. Next, we want to repair and soothe the esophageal lining. Natural medicine has many substances such as DGL, slippery elm, fresh red cabbage juice, as this is particularly healing to the stomach and the esophagus. The next thing we want to do is we want to restore the stomach acid secretions and digestive health to its original state. Remember, like when you were 25. So we use plant-based digestive enzymes, antioxidants, natural anti-inflammatories, and probiotics. All of these are important as we work to strengthen the digestive system. In the 20 years I've been in practice, I have helped thousands of people overcome gastric reflux, most of the time with dietary changes and supplementation, lifestyle changes, and it just goes away. They don't have to think about it again. And better yet, they don't have to be dependent on a medication. So thank you so much for connecting with me today. You can come to my website at www.drandreapurcell.com. You can continue to follow me here on YouTube, and you can visit me and check out some of my other videos. I'm so happy that you're here and that you made your health a priority. So you take good care, and I'll see you next time.